Hello and welcome to this presentation that will cover how we completed an overview of reviews to determine how to set population-level health research agendas. Just to introduce ourselves, my name is Audrey Tan and I was the primary author. The work was commissioned by Ms. Tanya Kukenmuller, and our co-authors were Dr. Tarang Sharma, Dr. Mona Nasser, and Dr. Sumedh Nagraj. We just wanted to note that the work was commissioned by the WHO region for Europe. However, the authors alone are responsible for the views expressed in this paper, and they do not necessarily represent the views, decisions, or policies of the institutions with which they are affiliated, including the World Health Organization region for Europe. Evidence-based approaches have become a key part of informing decisions on how to conduct and organize research. This includes how to set priorities for research, which is a political and social process that is informed by the views and experiences of the stakeholders, along with available data and information. There's been a proliferation of primary literature on the conduct, evaluation, and reporting of research priority setting, as well as a subsequent increase of systematic reviews focusing on those areas. While there are documents, such as the World Health Organization's 2020 guidance, draw on existing research priority setting experiences and examples of good practice, the methods used in the development of these documents are not always inclusive of a systematic evaluation of the literature. Recent systematic reviews have also acknowledged the high degree of variability in methods used for collecting priority topics and have expressed the need for more standardized methods. So, with our overview of systematic reviews, we aim to produce a framework for evidence-informed health priority setting processes to support the development of national public health research agendas. Due to budget and time constraints, we decided to use a rapid systematic reviewing method. Therefore, we searched two databases, which included Ovid Medline and the WHO Institutional Repository for Information Sharing. Our last search was conducted in May 2021, and eligible studies were in the date range of 2010 to 2020. Eligible studies could include critical or systematic reviews that evaluated research priority setting exercises. We used adapted frameworks for data extraction, synthesis, and quality appraisal, having adapted AmStar2, which is a critical appraisal tool for systematic reviews that include non-randomized studies of healthcare informations or both. And additionally, we also screened the cross-references of the included studies and contacted experts to find any missing literature. Our searches identified 2,388 records. Through a title and abstract screening and full text screening, we then identified 31 studies to be included in our overview of reviews. From these studies, the populations included were patients, families and carers, researchers and funders, clinicians and policymakers, and the topics ranged from covering specific diseases, healthcare practice, and priority setting methods themselves. The data were thematically analyzed by main focus, location, and context, and then integrated into a framework, which we have displayed here. So the four main phases identified in our framework included the preparatory phase, priority setting phase, follow-up phase, and sustainability phase. And now in the next 4 slides, I'll cover these in more detail. So when an organization or research body is looking to get started with their priority setting process, there are some steps that they should consider in the preparatory phase, including the people, the team who are going to be involved with the priority setting, what their objectives are, what healthcare context they're looking at, which stakeholders from the community and public they want to involve, and what the existing evidence looks like. For existing frameworks, note the importance of including relevant stakeholders in the process and having a participatory approach, which is also valued as a key component most of the other included reviews. Additionally, our overview highlighted the importance of having a bottom-up approach where researchers work with consumers in a co-design and co-production process so that resulting priorities are reflective of patient needs. In the second stage, which is priority setting, Those conducting the priority setting exercise also need to consider the criteria for the priority setting, what methods they're going to use for the participatory part with stakeholders, and how they're going to report the findings. Our overview found that included studies usually used a combination of mechanisms, such as surveys, workshops, and expert consultation, often as part of a formal process for determining priorities, such as the CHNRI, Delphi, and James Lind Alliance methods. The existing frameworks do not clearly outline what methods should be followed when setting priorities, nor do they discuss the importance of integrating qualitative with quantitative data to understand the reasoning behind stakeholders' rankings. The qualitative evidence gained through focus groups and interviews can provide valuable insights into the lived experiences of patients and consumers to contextualize quantitative rankings of priorities and should be included into processes. From our overview, we know that there is a lack of consistent reporting, and the authors of the reviews recommended having multidisciplinary advisory groups to oversee the whole process. It was also noted that often the costs, mechanisms, and details of patient and public participation are not reported, making it difficult for replication, though some advice around recruitment has been available. Once the priority setting exercise is completed, you then have the follow-up phase. And in this phase, you want to consider dissemination, how the findings will feed back into research, and also how you will evaluate the priority setting making process. Two of the existing frameworks included in our overview and our own overview discuss the importance of having a structured dissemination strategy that shares the priorities with key organizations and stakeholders to facilitate their subsequent implementation. Our overview also highlighted that the translation of these research priorities should account for societal and cultural differences as they are translated across different communities and settings. The evaluation of the priority setting process was considered in all four of the existing frameworks, as it was in our own included studies. Two of the frameworks considered some elements of research funding cycles within their feedback and evaluation domains. Our overview noted that the impact of priorities should be monitored by assessing whether priorities are reflected in grants being awarded. The last phase is the sustainability phase. The most notable difference between our framework and that of the WHO's is our sustainability phase, which includes considerations for developing mechanisms for institutionalizing the priority setting process into the research cycle and creating peer learning amongst colleagues and regions. This element of sustainability is crucial for ensuring that policymaking is underpinned by prioritized research and that the priority setting process can build a wider community of practice. One of our included reviews highlighted the value of institutionalization, which is ensuring that priority setting processes are cyclical as opposed to singular one-time events. Two of the reviews also noted the importance of economic aspects of priority setting processes to ensure that an environment or context is made whereby research priorities are taken forward. The four reviews included in our studies that focused on low and middle income countries recommended establishing communication channels with neighboring countries to share best practices, establish regional health research agendas where possible, harmonize priority setting process to enable greater comparability, and strengthen collaboration. Since our overview was published in January 2022, we've had a number of engagement, policy implications, and citations. For example, the manuscript and framework was shared with the WHO Eastern Mediterranean Region Office for them to consider during the deliberations for priority setting support to countries in the WHO Eastern Mediterranean region in developing their own research agendas. Additionally, our paper has been cited twice, once in a paper to support vascular disease research priority setting in the UK and another to support health literacy in Italy. We've also had further collaboration with the WHO through the WHO Evidence to Policy and Impact Unit and Instituto Veritas in Brazil. In terms of next steps and future research, the best way to really determine the framework's impact on policy and practice would be to go through pilot testing it with some countries. And through implementation and use, we could then further refine the framework to ensure it is fit for purpose, not only based on theoretical literature, but also what works in practice. If you have any questions or would like to discuss our paper or presentation further, do not hesitate to get in touch. My email is audrey.tan@ucl.ac.uk, or I'm also on Twitter @audrey.r.tan. Thank you very much for your time. I hope you enjoyed the presentation.